Hello everyone and welcome to Know Your Drug, the ultimate destination for all things of health and wellness from the fascinating world of pharmaceuticals. We are here to guide you on Diclofenac tablet, exploring the various aspects of diclofenac, their usage, dosage, mechanism of action, side effects, and most importantly, essential advice for taking them safely and responsibly. Before we begin, let me emphasize that the content provided in this channel is purely educational. Always consult a healthcare professional for personalized advice regarding medications. Now, let's get started. Use of Diclofenac tablet. Diclofenac is a nonsteroidal anti-inflammatory drug that is commonly used for its analgesic and anti-inflammatory properties. It is used to treat a variety of conditions, primarily related to pain and inflammation. Here are some common uses of Diclofenac tablet. Diclofenac is often prescribed for pain relief, inflammatory conditions, postoperative pain, migraine, soft tissue injuries, back pain, dysmenorrhea, ankylosing spondylitis, and gout. Dosage of Diclofenac tablet. The dosage of Diclofenac tablet can vary based on the specific condition being treated, the severity of symptoms, the patient's age, weight, and overall health. The following dosages are general guidelines and may not be appropriate for everyone. Always consult your doctor before starting or changing any medication regimen. For pain relief and inflammatory conditions, the typical initial dose for adults is often around 50 mg to 75 mg per day, divided into 2 to 3 doses. For more severe conditions, the dose can be increased to 100 mg per day in divided doses. For osteoarthritis and rheumatoid arthritis, the usual starting dose is around 50 mg to 75 mg per day, divided into 2 to 3 doses. In some cases, the dose might be increased to 100 mg per day. For migraine, the initial dose is usually around 50 mg at the first sign of migraine symptoms. A second 50 mg dose can be taken after 2 hours if necessary. For dysmenorrhea, the initial dose is typically around 50 mg, followed by additional doses if needed. For ankylosing spondylitis, the usual starting dose is around 25 mg to 50 mg per day, taken in divided doses. In some cases, the dose might be increased to 100 mg per day. It's important to note that these are general guidelines, and your doctor will determine the most appropriate dosage based on your individual circumstances. Mechanism of action of Diclofenac tablet. Diclofenac, a nonsteroidal anti-inflammatory drug, works by inhibiting enzymes called cyclooxygenases. There are 2 main isoforms of cyclooxygenase, COX-1 and COX-2. These enzymes play a crucial role in the synthesis of prostaglandins, which are chemical messengers involved in inflammation, pain, and fever. The mechanism of action of diclofenac involves its ability to inhibit both COX-1 and COX-2 enzymes, although it has a higher affinity for COX-2. Here's a breakdown of its mechanism of action. Inhibition of COX enzymes. Diclofenac interferes with the activity of both COX-1 and COX-2 enzymes. COX-1 is constitutively present in many tissues and is involved in maintaining normal physiological functions, such as protecting the stomach lining and promoting platelet aggregation. COX-2, on the other hand, is induced during inflammation and is primarily responsible for generating prostaglandins associated with pain and inflammation. Reduction in prostaglandin synthesis. By inhibiting COX enzymes, diclofenac reduces the synthesis of prostaglandins from arachidonic acid. Prostaglandins are responsible for mediating the processes of inflammation, pain, and fever. By decreasing their production, diclofenac helps to alleviate these symptoms. Anti-inflammatory effects. The inhibition of COX-2-mediated prostaglandin production leads to a reduction in local inflammation. Inflammatory prostaglandins cause blood vessels to dilate, leading to increased blood flow to the site of injury or inflammation. By blocking their synthesis, diclofenac helps to reduce swelling, redness, and heat associated with inflammation. Analgesic effects. By reducing the production of prostaglandins in peripheral tissues, diclofenac helps to decrease pain at the site of injury or inflammation. Prostaglandins sensitize pain receptors and contribute to the perception of pain. Antipyretic effects. Diclofenac's ability to lower fever is due to its inhibition of COX-2, which is involved in the production of prostaglandins in the brain that regulate body temperature. It's important to note that while diclofenac's mechanism of action is responsible for its therapeutic effects in reducing pain, inflammation, and fever, it can also have side effects. Side effects of diclofenac tablet. Diclofenac, like other nonsteroidal anti-inflammatory drugs, can cause a range of side effects. Here are some common side effects of diclofenac tablets. Gastrointestinal effects, cardiovascular effects, renal effects, hepatic effects, skin reactions, central nervous system effects, hematological effects, respiratory effects, fluid retention and swelling, and allergic reaction. Before starting diclofenac or any other medication, discuss your medical history and current medications with your healthcare provider to ensure that diclofenac is a safe and appropriate choice for you. Important advices for using diclofenac tablet. When using diclofenac tablets, it's important to follow certain guidelines and advice to ensure safe and effective use. Here are some important recommendations. Always consult a doctor before starting diclofenac or any other medication. Take diclofenac exactly as prescribed by your healthcare provider. To minimize the risk of stomach upset, take diclofenac tablets with food, milk, or a full glass of water. Use diclofenac for the shortest duration necessary to manage your symptoms. Prolonged use can increase the risk of side effects. Alcohol can increase the risk of stomach irritation and bleeding when taken with diclofenac. It's advisable to avoid alcohol during diclofenac treatment. Be aware of potential side effects and monitor your body's response. If you experience any adverse effects, contact your healthcare provider. Regularly monitor your kidney and liver function if you are taking diclofenac, as it can impact these organs. If you have a history of heart disease, high blood pressure, or other cardiovascular issues, discuss the use of diclofenac with your healthcare provider, as it can increase the risk of heart-related complications. Diclofenac is generally not recommended during pregnancy, especially in the third trimester, as it may affect the developing fetus. Consult your doctor if you are pregnant or planning to become pregnant. Diclofenac can pass into breast milk and may not be recommended while breastfeeding. Inform your healthcare provider about any allergies or sensitivities you have to medications, especially NSAIDs. Inform your doctor about all the medications you are taking, including over-the-counter drugs, supplements, and herbal products. Diclofenac can interact with other medication. If you experience severe side effects, such as gastrointestinal bleeding, allergic reactions, or symptoms of heart problems, seek medical attention immediately and consider discontinuing diclofenac. Store diclofenac tablets as per the instructions on the packaging. Keep them out of reach of children and away from moisture and direct sunlight. Remember, the information provided here is for general guidance. Your healthcare provider is the best source of advice specific to your health condition and needs. By the end of this video, you'll have a solid understanding of the use, dosage, mechanism of action, side effects, and important advice for taking diclofenac tablet. Remember, knowledge is power, and being well-informed empowers you to make the best decisions for your health.